So action research is part of a human ecosystem. So the work of Svante Liefegren began many years ago. He's an MD, as you can see, and he then did his PhD in action research because he got excited about the possibility of using action research to help transform the Swedish healthcare system. So I love people when they have big lofty goals, you know, not just like little ones, but big lofty ones, but also work in the local context, because as action researchers, we believe it's the local context, these small meetings that then reach out into larger meetings. And the big lofty goal was, okay, we have healthcare like in every country in the rich world, in the developed world, aging populations, chronic healthcare, costs, doctor shortages, and what are we going to do about it? So Svante and his team at Chalmers were not about making something happen, but helping it happen. And I think that's a first good thing to understand about action research. We understand we're living inside an emergence of things, and how do we nudge it? Especially as social scientists, we know a thing or two about how to nudge change. And so in this work, the first person pathway from patient goes to the clinic and basically does what the healthcare system wants, to the transformation, which is the patient becomes the center, the attractor of the new system, around which healthcare will now begin to redesign itself. So that's what the action research was about. That was the vision over 10 years ago, and I'm now reporting on where we've gotten with that. But the big picture is, so that's the first person, let's design around the patient. The second person is, let's obviously, action research always requires some kind of learning or dialogic platforms. Let's have a platform which will include obviously the patients, but also the healthcare providers and that system that will help things change. That would be the second person piece. And the third person piece is, we need to document this, both for ourselves, we need quantitative understanding of costs and all that kind of stuff, but we also need to produce papers and share it with the larger world in Sweden, but in fact with the world, so that others can begin to do things like this. In action research, we don't believe that things can be generalized. We believe in social proliferation, that in telling the story in a designed context, people will pick it up and bring it to their own context. So we have to think in terms of holons. So the small system within the larger system, it's the holons together who will engage in learning platforms. And in this particular case, don't worry about all the details. In this particular case, folks from a hospital, a number of hospitals, come together around a particular topic. Let's say it's cancer treatment, and then it's all held, all these different holons are held in another holon called the learning platform. And in turn, that can then reach back out to clinic, to management, and so on. So this is one simple, so you have a picture in your head of what a learning platform looks like. Literally, I mean, because they're Swedish, they're all a little bit too white, aren't they? In the United States, we care a great deal about diversity. And the Swedish context brings together patients, physicians, so on and so on. So this is what it kind of looks like. So keep that in mind as I give just one tiny example of one of the projects that came out of this learning platform. So remember, we're trying to go to the patient, right? And then other things pop up in that system. One of which in this particular experiment was Gothenburg City became concerned about cancer screening among immigrant populations. So many refugees, as there are in Germany, coming into Sweden, but what about screening? This will be very costly down the road unless we do screening and prevention. How do you reach into a community of women, in this case, who've come out of a more patriarchal tradition that has not cared about women's sexuality or women's bodies, perhaps all that much, into this new context where, you know, it's a bunch of white people who are in charge and many of the physicians are male, and so on. So how do we grapple with that, right? So the experiment becomes, how do we turn this problem of diversity into a resource, and how do we reach out as partners, as action researchers always want to do, to these stakeholders. And so then it became very simple. It's easy. We simply ask the doulas from the immigrant population to be the leaders in going to the patient. And that sounds simple enough, but remember, a lot of money is involved in this, because then you're building buses with cancer screening and going into the community so that the women can come onto the buses and do their cancer screening and go back into their community. So that was the simple idea. That was the simple practice. It worked very well. At the heart of it was bringing in folks that the learning platform did not yet know, and trusting them enough that money and whatever resources could be devoted to this project. That's the hard part, right? The trust building, the relational space is actually the hard part. All the rest was rather simple. And remember, this stuff needs to be in third person domain. It needs to be studied, acknowledged, controlled, like was that a good intervention? Was that a bad intervention? And allowing each other to make mistakes. So I hope that gives you a little flavor. Over the course of many experiments like this around the western region of Sweden, it became cost neutral. This shift to the patient, which is very costly, buses, sending nurses out to people's houses, this is costly. The money came from stopping patients coming into the clinic, because an emergency room visit in the United States is $1,000. And nurse visit is $100. So you're saving already 90% of your resources. That's what's behind these numbers. And therefore, you're freeing up resources so that the system can continue to have the patient as the attractor. In my conversations with Svante, I believe, I think he agrees, that the butterfly, the early butterfly effect that caused this transformation was Svante's patient Lars, who had COPD, cannot breathe, bronchial issues from smoking really too much. And Lars, when he understood that when he has asthma and when he's very afraid, he no longer has to get himself to the emergency room. He can call and a nurse will come to his house. And he said, I went in and out of the hospital for 3 years and it was dreadful. Now the mobile team comes to me and they support me in my home. This is Dulux Care. And I just think it's so beautiful. It's so simple. And it also saves a great deal of money. So, bottom line, here's a picture of how action research works in this particular context. Because it's Sweden, by American standards, it's very small. The Ministry of Health got to know about this work that affected 100,000 people. It wasn't tiny, it affected 100,000 people. Said, we love this. How can we bring this to all the regions of Sweden? And the answer was, let's not just write up papers and tell people what to do, because nobody ever does that. Let's host our learning platforms, remember, and bring in people from other regions, and they can hear us talking and they will begin to get an idea, oh yeah, we could do that, or but we can't do that. And that way there's a social proliferation mechanism. So fundamentally, this is just one little example of how action research comes alive in learning conversations among action researchers. You got a taste, I hope, of the relational space there. You got a taste of how people would bring in their many different ideas, and that there would be collaborative experiment, right? Ideas without experiment don't really count in action research. And then you go back into a cycle of timely action together, because it might be timely to invite in your immigrant community in one particular place, but it's not timely in another. There isn't enough trust built. So new mindset, new results. Now, Svante hates me to say this, but it's true. Svante himself is a very conscious leader. He is somebody, the reason he hates me saying it is because it sounds like we're so leadership focused, and we're not. But there's a requirement in these systems for people to step in with good ideas and then give them away. And not everybody is able to do that. And so my particular passion has become, how do we have at least a few more people? We're thinking we're around 5%. And those numbers for me come from my work with Torbert. I think the N is over 5,000 people at this point. When you look at leaders, which includes educators, scholar practitioners, not that many of us are operating at this level. How do we have more of that has become my question. How do we develop? And it's not new. You know, academia really reinforces novelty. This is not new. Aristotle was talking about praxis and phronesius 2,500 years ago. How do we do it becomes the action researcher's question. And of course, we also care about good ideas. So my one suggestion before we move on a little bit is, let us also open our mind about what is knowledge. The conversation with the doulas is a form of new knowledge making, which led into a different kind of practice. The learning platform is a beautiful, very conventional way of being in dialogue together. I have a picture up here of theater. I myself have trained myself in community theater. Action researchers, we love Theater of the Oppressed. If you know that work, Augusto Boal from Brazil, who was also a very political man. Any kind, and you will have your own even better ideas, any kind of way in which we can make power discussable and feel the power change means we're remaking social systems, and that becomes the context then for inquiry. I think I'm gonna stop after this one. So some key principles to keep in mind around action research, especially if it's new to you, is that what we are doing is very human-centered. So it's not Descartes or Newton's kind of research. I always say a little bit as a joke, but it's true. If you read their biographies, like Newton had one romance in his whole life, and it was at the age of 14. And once it was finished, after a few days, he said, well, I'll never do that again. And I think it tells us something about the kind of masculine, I have masculine, women and men have masculine, masculine non-relational orientation. And I think the action research orientation wants to walk on 2 feet, wants to bring in more of a feminine appreciation of relationship. And one of the difficulties for us with that is patriarchal science has been very objectifying. Objectivity is very, very, very close to objectification. And so there's a whole political issue there, and our need to wake up from that, and our need to bring in more of a feminine and eco-feminine, perhaps, point of view. That in turn forces us to confront power structures. It's not just, oh, let's all love each other. There's power structures that keep systems in place, and action research needs to unfreeze those power systems. And fundamentally, we do that in this integration of first person, second person, and third person, where there's a social proliferation that we keep our eye on as we try to both fix systems, but also inquire into what are the values that gave rise to these systems in the first place. So again, we're walking with 2 feet. I think this is a very important way of thinking about what we're doing, from moving from power over to power with. Let me stop there. I'm going to check the chat and see if there are questions, just for clarity, before we go into our breakouts. I have a specific exercise to invite you into.